All of you to this evening's special decadal program of ICGC and IMA. It's a very special occasion for us. It's been exactly 10 years since we started our first child guidance clinic in Vijayawada. The main reason behind starting this clinic at that time was that most of the children who had special needs, autism gani, ADHD gani, mental retardation, Downs, ఇలాంటి పిల్లలందరినీ కూడా they used to bring them to an adult psychiatrist like our center, where on one side you have patients with serious mental disorders like schizophrenia, bipolar disorder, and on one side you have a small 3-year-old child with a parent or the father and mother or grandparent coming there, and many times it's a very overwhelming experience for any parent to bring their child to a psychiatric hospital, because traditionally that's where most of these developmental disorders were being taken care of. That's one reason. The other thing is, ఆ టైంలో విజయవాడలో అరౌండ్ 2012-13 కూడా ఒక చైల్డ్ హూ హ్యాస్ సే స్పీచ్ డిలే, అట్లాగే గ్రాస్ మోటార్ ఫైన్ మోటార్ డిలే, అట్లాగే ఎమోషనల్ అండ్ బిహేవియరల్ ఇష్యూస్, ఇవి ఉన్న వాళ్ళని దే హ్యాడ్ టు టేక్ దెమ్ టు మల్టిపుల్ ప్లేసెస్ మా దగ్గరికి ఫర్ సైకాట్రిక్ అండ్ సైకలాజికల్ సర్వీసెస్. Then mother had a kinetic Honda, she would take the child to one town for speech therapy, then to Patamata for occupational therapy. Those were the hardships of parents, because there was not a single center which would cater to all these things under one umbrella. So that was such a hardship for many parents, and we didn't even have qualified people in Vijayawada at that time. And a qualified occupational therapist kanivandi, speech therapist kanivandi, clinical psychologist kanivandi, ilanti vallu evaru kuda appudu leru. So we thought it's very important to create a separate physical infrastructure, not in the same place. Adults ni chusina chote children ni chodakunda వాళ్ళకి సపరేట్గా ఒక ఇన్ఫ్రాస్ట్రక్చర్ క్రియేట్ చేసి ఒక మంచి ప్లే స్కూల్ లేదా ప్లే ఏరియా లాంటి అంబియన్స్ క్రియేట్ చేస్తూ ఈ చైల్డ్ సైకాట్రిక్ సర్వీసెస్ అన్ని కూడా ఒక రూఫ్ కింద నడపాలనే ఉద్దేశంతో we started ICGC in 2015 February. The other thing that we could do is we also run DNB psychiatric courses for the last 18 years or so. So DNB psychiatric courses lo మా దగ్గర పాస్ అవుట్ అయిన వాళ్ళు, those who've shown interest in child psychiatry, they've completed their PDF with us, postdoctoral fellowship in child psychiatry, and subsequent to that, if they are interested in setting up a clinic, we have supported them in every which way, in investing into the physical space, into human resources. So in that sense, Dr. Manjari was one of our early DNB psychiatry residents. She's from Bombay. She did her fellowship also in child psychiatry. And after that, when she was going back to Bombay, we were seriously considering this option of opening a center in Bombay also, because she showed a lot of interest in child psychiatry. So we took a place, we built the human resources around her, and that's how our Bombay unit started in 2015, late 2015. After that, we started a similar unit in Vizag in 2019, again with one psychiatrist who worked with us, who did her fellowship with us in Vijayawada. So there is no big urgency for us to expand. 10 years లో ఓన్లీ 5 centers ఉన్నాయని ఒక సైడ్ నుంచి చూస్తే 10 years లో 5 centers చేశారు అని కొంతమంది అంటారు. బట్ ఐ థింక్ వీ హ్యావ్ నెవర్ బీన్ బిహైండ్ ర్యాపిడ్ ఎక్స్పాన్షన్. మా తర్వాత వచ్చిన చాలా సెంటర్స్ 5 years లో 6 years లో 20-30 centers పెట్టి ఫ్రాంచైజ్ మోడల్ అని అదని చేస్తున్నారు. కానీ అవర్ అప్రోచ్ ఆల్వేస్ హ్యాస్ బీన్ టు హ్యావ్ గుడ్ పీపుల్ who run these centers, and we don't want our credibility to go in this whole process of running these clinics, because it involves a lot of one-on-one work. అడల్ట్ సైకాట్రీలో కానీ మిగతా మెడికల్ స్పెషాలిటీస్లో మనం చేసినట్టు ఒక టాబ్లెట్ ఇచ్చామో లేదా ఒక ఇన్వెస్టిగేషన్ చేసామో అలాంటి క్విక్ రిజల్ట్స్ ఏమి ఉండవు చైల్డ్ సైకాట్రీలో. ఇట్ ఈస్ అ లాట్ ఆఫ్ హార్డ్ వర్క్, లాట్ ఆఫ్ టాయిల్, అ లాట్ ఆఫ్ వన్-ఆన్-వన్ వర్క్. సో ఇట్స్ వెరీ ఇంపార్టెంట్ టు హ్యావ్ ద రైట్ కైండ్ ఆఫ్ హ్యూమన్ రిసోర్సెస్, అండ్ దోస్ ఆర్ వెరీ వెరీ డిఫికల్ట్, especially in a child psychiatric setup, to get qualified speech, occupational therapists, and so on and so forth. So luckily, we have been managing, and now we have 5 centers. Recently, Chembur and Bombay, we started our second center. In fact, our Bombay centers are like our flagship centers. They are doing quite well. And in Bombay, if somebody needs child psychiatric services, they would first actually think of ICGC, because of the kind of reputation that we've created over the last 10 years. So this is the brief background of why we thought of ICGC and how we've started it. Now it's been 10 long years, and without the support of our local medical brethren, our medical colleagues here, we wouldn't have achieved what we have done in the last 10 years. So this occasion today is to just once again acknowledge the support that we've received from all the medical specialists in Vijayawada, and to thank you all, and also to strive and continue to do the kind of work that we are doing. So once again, thank you for making time and coming here on a Sunday evening for this special CME on child psychiatry. Thank you very much.